All right, so we'll mainly just be looking at some terminologies. All right, so we're trying to define these terminologies because you actually hear us calling them out. Okay, this. So I'm coming. So we'll talk about what is reactive gastropathy. We'll talk about what is eosinophilic gastritis. We'll talk about what is lymphocytic gastritis. They'll also get to talk about what is granulomatous gastritis. Okay, so for all of them, they are just forms of gastric mucosal injury or inflammation. Okay, so all of them, they have unique features. That's why we want to now make a video to clear it up, So for what we have here, reactive gastropathy is known as chemical gastropathy. So it's caused by chemical irritants. So bile reflux, NSAIDs. Okay, bile reflux, NSAIDs, alcohol, chemotherapies. So histology, they are usually caused by foveolar hyperplasia. Okay, tortuous glands, like what you see. Okay, that's for reactive gastropathy. Smooth muscles will be getting so large. That's hyperplasia. There's edema and there's vascular congestions. Okay, so often no symptoms, but sometimes you have issues like this, reduced digestion and erosions. Okay, so it's not a true gastritis. Okay, because inflammation is minimal. That's why they say reactive gastropathy or chemical gastropathy. Therefore, eosinophilic gastritis now is a rare type of inflammation where you see that eosinophils they're actually so much, so they infiltrate the gastric mucosa. You see that eosinophils are so much, often with mucosal edema, and sometimes it can get so large that you are feeling this is a tumor. So it can be idiopathic, sometimes could be due to allergies, sometimes could be due to parasitic infections, okay, and all of that. So clinical features, there's abdominal pain, nausea, sometimes obstructions. Okay, so diagnosis require you are trying to rule out the various causes till you get to a particular cause. Okay, so lymphocytic gastritis is marked by intraepithelial lymphocytosis. So lymphocytes are so much, okay, in the epithelial cells there. So there's dense intraepithelial lymphocyte, often with chronic inflammation in the lamina propria. So it's linked to celiac disease. It's also linked to the Helicobacter pylori. So it's also seen associated with HIV infections and all. So the person will be suffering from abdominal pain, dyspepsia, okay, then and all of that. Okay, so granulomatous gastritis is presence of granulomas. The gastric mucosa is non-cacheating or cacheating granulomas, depend on the cause. So etiology could be caused by infections like Mycobacterium tuberculosis, histoplasma, parasites. And sometimes it's caused by Crohn's disease, sarcoidosis, vasculitis, foreign body reactions. And sometimes the cause is not known. Okay, so describing all these terminologies that we'll soon be mentioning here and there, this is what they actually are.